Performance Measures for Lower Gastrointestinal Endoscopy, a European Society of Gastrointestinal Endoscopy, ESGE, Quality Improvement Initiative. The European Society of Gastrointestinal Endoscopy, ESGE, and United European Gastroenterology, UEG, have identified quality of endoscopy as a major priority. The authors described their rationale for this priority in a recent manuscript that also addressed the methodology of the current quality initiative process. Because of the variation in physicians' performance and the introduction of nationwide colorectal cancer, CRC, screening programs, lower gastrointestinal, LGI, endoscopy was the first area of endoscopy to address quality. Over more than a decade, several potential measures of quality in LGI endoscopy have been identified. In consequence, many professional societies have published recommendations on performance measures for LGI endoscopy. These recommendations are, however, numerous, 44 different performance measures, country-specific and not always evidence-based, which has limited their wider adoption in Europe. The aim of the ESGE LGI working group was to identify a short list of key performance measures for LGI endoscopy that were widely applicable to endoscopy services throughout Europe. This list would ideally consist of performance measures with the following requirements: proven impact on significant clinical outcomes or quality of life, a well-defined, reliable, and simple method or approach for measurement, susceptibility for improvement, and application to all levels of endoscopy services. This paper reports the agreed list of key performance measures for LGI endoscopy and describes the methodological process applied in the development of these measures. General conclusions, research priorities, and future prospects. This paper describes a short list of key performance measures for LGI endoscopy that have the best evidence-based impact on clinical outcomes while being feasible to measure and susceptible to improvement. The systematic process of development of these key performance measures revealed broad variation in the available evidence between the performance measures in different quality domains. Although the domains of completeness of procedure, identification of pathology, and pre-procedure have relatively robust scientific support, others, such as management of pathology and patient experience, are rather understudied. Indeed, these two quality domains were listed among the key research priorities by the ESGE Research Committee and are considered key research questions by the LGI Working Group. The other notable feature of the identified performance measures is that the evidence behind them comes almost exclusively from the field of CRC prevention and early detection. Although performance measures from the pre-procedure and completeness of procedure domains are largely universal, performance measures within the identification of pathology, management of pathology, and post-procedure domains are not applicable outside of the CRC screening or surveillance setting. Further research on these topics is warranted. The first step now is to implement these key performance measures in endoscopy practice throughout Europe. Kaminski et al. Encourage individual endoscopists, as well as heads of endoscopy units, to start implementation of the performance measures without delay. Implementing performance measures is important to identify services and individual endoscopists with substandard levels of performance. The aim is not to penalize these endoscopists or services, but to have a tool to improve the quality of endoscopy. Feedback and benchmarking of colonoscopy performance measures are usually sufficient to positively influence the overall quality of colonoscopy. If the provision of such information turns out to be insufficient to promote improvement, the next step is to provide assistance and additional training. At a service level, the implementation of key performance measures may well require investment in hardware to accommodate a more efficient auditing process. The authors want to encourage hospital management to support the implementation of these performance measures in their endoscopy services. Kaminski et al. Think that, in an era where general hospital accreditation has become increasingly important, hospital administrations will be more susceptible to support such actions. Moreover, we owe it to our patients to overcome individual or financial barriers to ensure that endoscopy services are of the highest quality, and to set research priorities to gather data that will inform the next generation of performance measures.